Welcome back. If you're hearing me, it's because you made it and you caught the last pop quiz we had. This is apparently a day of pop quizzes, and mine was to tell you that we were done for the day after the last session. Gold star to anybody who heard that and knew better to disregard it and came back. That's exactly the kind of attention to detail that enrollment assisters need. So great job. I'm super happy to welcome you back and to have this next session. For those of you who initially joined us early last week for the pre-licensing, you are already familiar with our next session moderator, Elizabeth Rothy. Elizabeth joined Covering Wisconsin just last year as our new workforce and affiliates liaison. In this role, she facilitates support and guidance for Covering Wisconsin's many sub-awardee navigator affiliates around the state. The affiliates allow for Covering Wisconsin's navigator services to be available to residents in all counties. Elizabeth tracks both the requirements for Wisconsin's navigators and certified application counselors to pursue and retain their state licensing, as well as the rules surrounding protecting the privacy and confidentiality of those we serve. Most recently, she worked as a Health Connect coordinator and outreach liaison at United Way of Dane County, and since then has been impressive in her desire and ability to step forward in all ways that are needed to assist all of you in your enrollment assistance roles. So welcome, Elizabeth, and I'm going to hand it over to you.
Good morning, everyone. Allison, thank you so much for that very kind introduction. We are moving into the Unraveling, the Unwinding section of our session today and going over what Medicaid changes we can expect and how to adapt. Please put all of your questions into the live Q&A to prepare for the question and answer at the end of this presentation. Please note that not all questions will be answered today. And for any members of the media in the audience, this session is not to be viewed as a press conference. Any on-the-record media questions should be directed to the media offices of DHS and OCI. Today we have Autumn Arnold, who serves as section manager for the Healthcare Eligibility Policy section at the Wisconsin Department of Health Services. In this role, she leads a team of analysts charged with interpreting state and federal Medicaid policy, as well as implementing projects and improvements related to Wisconsin's healthcare programs. She has worked with DHS in a number of different roles for over 15 years, with a focus on initiatives that seek to increase access to health and nutrition benefits. Prior to working in Wisconsin, she served as Director of Food Stamp Policy Advocacy for California Food Policy Advocates, an education and advocacy coordinator for the San Francisco Food Bank. She is a graduate of Duke University and lives in Madison with her partner and 7-year-old son. We also have Nicole Huffman, and she is a program and policy analyst advanced for the Healthcare Eligibility Policy section at the Wisconsin Department of Health Services. Her policy expertise spans across Wisconsin's Medicaid, Badger Care Plus, and supplemental security income programs. She has been working in various roles with DHS for 15 years. Nicole has a bachelor's degree in political science and legal studies from UW-Madison and earned her MBA with emphasis in healthcare and public administration. She lives in DeForest with her husband and 2 sons, ages 1 and 3. Nicole and Autumn, please go ahead with your presentation whenever you're ready.
Okay, great. Good morning, everybody. Thanks for your time today. I'm very pleased to be here. We have a number of things on deck for today. The first thing we'd like to do is the briefest possible recap of what's going on with Unwinding, since you've already heard quite a bit of Unwinding at this conference. And then we'll turn our attention to what is coming in 2024. And to do that, I'm planning to do a quick map refresher, talk a little bit about policy reinstatement in 2024, and then I'll turn things over to Nicole, who will provide an update on the new policy of 12-month continuous coverage for children. We are going to attempt to do all that and still leave a good chunk of time for questions and answers, and we'll try really hard to keep an eye on the time so that we don't squeeze that out. Okay. So, just in case anybody is new to this world and has not been in the conference yet, wanted to provide just a quick overview of what we are talking about when we talk about unwinding. Unwinding is the term that our federal partners came up with and used to describe us returning to routine operations in the Medicaid program as we wind down or unwind the temporary policies that were in place during the pandemic. The major policy change, as most of you know, that's in play right now is around continuous coverage, which was a policy in which Medicaid and Badger Care Plus members retained coverage it sort of indefinitely once they became eligible during the pandemic. The only exceptions to that were if they moved out of state, if they passed away, or if they asked to be disenrolled. And so as we have been unwinding, um, those that continuous coverage has really been our area of focus. And I would say that April 1st was really the kind of has been the line in the sand on that particular policy. If someone applied on or after April 1st of this year, they no longer they did not get continuous coverage, right? They're subject to normal rules where they might become eligible, but if they have a change in circumstance, like they go over the income limit or they have too many assets, then their coverage could end. This is in contrast to existing members who had continuous coverage during the pandemic and who keep that continuous coverage until we do a full redetermination of their eligibility. And for the vast majority of people who had continuous coverage during the pandemic, that full redetermination of eligibility is their next renewal, which is that time that normally happens annually where we review the household circumstances, we see what people's income is, what their assets are, and we determine if they still meet the program rules. Those renewals were on pause during the pandemic. And so when we started unwinding, we took everybody, almost everybody who was enrolled in Medicaid, and took those renewals and distributed them evenly over 12 months from June of 2023 through May of 2024. And so since June, we have been doing a monthly cycle of sending out notifications about renewals, getting information back from members, and processing those renewals. And so that piece of unwinding is very much underway. I know that you will have many other opportunities to see these resources and hear about them, but I just want to make sure that I do a brief highlight of three of the most critical resources we have for partners during unwinding. We have an extensive partner toolkit that has all kinds of materials and information that's helpful for people who are supporting members with unwinding. We also have the DHS Forward Health Partners inbox, which I'm sure many of you are very familiar with. And then we also have a dedicated listserv that you can sign up for on unwinding. So if you are not already connected with those resources, strongly recommend that you do get connected. Okay, so that was the quick version of what is happening now. And the way that I think about this and think about unwinding is that we've been sort of in phase one, right? Phase one has been getting renewals going, starting to do those redeterminations, moving under federal guidelines from people having continuous coverage to going back to regular rules as they do their renewals. But there's also sort of a phase two of unwinding, which is for us to address other policies that have been suspended during the pandemic that are going to where we're going to need to make some changes to put some of them back into place. Um, as you can see here, there's a list of about 5 policies that are still suspended. And I want to talk through these in some detail because these are all important and there's a little bit of a different situation with each of them. The first set of policies have to do with Badger Care Plus childless adults. You may remember, those of you who've been around may remember that in late 2019, early 2020, we were on the cusp of implementing premiums and a question about members' need for substance use treatment as part of a legislative requirement for our coverage of childless adults. We were right on the cusp of doing that, and then the pandemic hit, and so we stopped. And where this stands right now is that as we move toward January 1st, which is, as I'll say in a minute, kind of our target date for reinstating other policies that continue to be suspended, we do not plan to reinstate those two policies for childless adults. Our federal partner, CMS, has indicated that they do not plan to approve that piece of the waiver that allows us to cover childless adults under Badger Care Plus. And so we don't have anything in writing. We don't have an official word. I cannot say with absolute certainty at this point, but all signs point to CMS will not approve those two pieces of the waiver. And so we are not preparing at this point to reinstate them. The next item that I wanted to talk about is premiums for children in Badger Care Plus. Again, if you've been around for a while, you know that pre-pandemic we had premiums for children who had household incomes above 201% of the federal poverty level, and we are planning to reinstate those premiums. We are stalling a little bit on talking about that and putting it in writing everywhere because there have been some conversations at the federal level around the intersection between premium payment for children and continuous coverage for children, the new policy that Nicole's going to talk about in the second part of this presentation. So uh, again, we expect to reinstate these. We expect to start doing that January 1st, and we will communicate to members once, as we lead up to that. But at this point, we are just giving it a little bit more time to see if we can get clear guidance in writing from our federal partners on exactly how this is going to go. So that is why I don't have slides on it, and why it might feel like we are being a little bit quiet on the subject of premiums for children. That brings us to MAP, which is for the Medicaid purchase plan, which is really the easy one and the one we're going to spend the most time on today. We suspended premiums for MAP members and work requirements for MAP members, and we are looking toward January 1st as when we will start reinstating those policies, but plan to start reaching out to members next month about both of those. Okay. So you may be asking yourself, why are we talking in detail about MAP during a session on unwinding? There's a couple of reasons for this. One is just that MAP policies have been suspended for 3 years. And so in general, we just wanted to make sure that everybody was up to speed on when we're talking about MAP and MAP policy reinstatement, what are we talking about? There are also a number of new policies that we were planning to put in place in 2020, but again, we stopped because of the pandemic. Um, and because of that, those policy changes, we felt like there may be members in Wisconsin who might have previously looked at MAP or considered MAP, but found it to be unaffordable or otherwise unappealing. And now that we've made some changes to the premium schedule in particular, we thought that it would be useful to revisit that in some detail and give you some tools around helping people reconsider MAP. Okay, so MAP, as many of you may know, is a program specifically for people who have a disability and who are working or enrolled in the health and employment counseling program. As such, it has higher income limits and asset limits so that people can earn more money and can save more money as a result of being employed. As I just mentioned, we have some fairly significant changes to the premium structure that happened in 2020, but were on hold because we had suspended premiums altogether. There are a few basic requirements for MAP, and I wanted to just highlight a couple of things. You'll see here that someone needs to have been determined disabled, and that can be either a regular disability determination from DDB, the Disability Determination Bureau. It can be a presumptive disability, or there is a special category determined by DDB called MAP disabled. And as I understand it, I'm not an expert in this area, but as I understand it, the main difference between regular disability determination and MAP disability determination is that with a regular disability determination, there is a limit on the amount of money that someone can earn. It's called the substantial gainful activity test. there's a limit on how much money you can earn each month and still be considered disabled. That piece of the disability test does not exist for MAP, which makes sense, right? Because MAP is a Medicaid program specifically for people who are working. So we don't want to put that cap on people. We want them to be able to work and earn money. And so that is how that category of MAP disabled came about. The other thing I want to highlight is that someone needs to have a work activity, and it needs to be at least one work activity per month. But it can be employment, it can be self-employment, it can be in-kind income, or it can be enrollment in that health and employment counseling program that I mentioned. Just to focus real briefly on in-kind income, this is a situation where someone is doing work in exchange for a service or product, not money. And the classic example in MAP, which I realize now that I used out of laziness, is walking a neighbor's dog in exchange for groceries. There are lots of different types of activities. It is not exclusive to dog walking, although that is an example you will hear frequently when you hear people talk about MAP. Um, Lots of things people may already be doing, like caring for grandchildren or doing yard work or other services like that where they get something in exchange that is not cash. The key things with in-kind income are that it needs to be regular and predictable, and it also needs to happen at least once per month. Um, I think this is a good moment to note that volunteer work does not count as employment for purposes of MAP. It needs to be done in exchange for something. Uh, As I mentioned, we have a health and employment counseling program where someone who is not currently meeting the work requirement but wants to be meeting the work requirement can enroll in MAP by submitting a plan that describes the activities that they're going to undertake to move toward employment. And so this gives people a period of 9 months with a potential for a 3-month extension in which even if they are not meeting the work requirement with employment, self-employment, or in-kind income, where they can still participate and they can work toward those employment goals. As I mentioned, the MAP financial limits are higher than most Medicaid programs. You can see here that the limit for income is 250% of the federal poverty level. Asset limit is $15,000, and it only counts the members' assets themselves. Um, I also just want to mention briefly that there are some specific provisions within MAP that allow certain types of assets to be exempt. And the one that we like to highlight is the independence account, which allows members to contribute up to 50% of their annual gross earnings into this exempt asset so that they can, again, be working, they can be saving their money from work, and it does not impact their MAP eligibility. I mentioned a couple of times that the MAP premium schedule has changed. Because of a state law change pre-pandemic, we needed to make some changes to how MAP premiums are charged. When we start reinstating MAP premiums starting in January, this is the new schedule. If someone has gross income above 100% of the federal poverty level, with some exceptions, they will have a premium. If they have gross income below 100% of the federal poverty level, no premium. The way that we calculate the premium is that we will take a base amount of $25 and then add 3% of their adjusted income that's over 100% of the federal poverty level. And I have an example in a second to sort of illustrate how that works. Before 2020, the premium cutoff was at 150% of the federal poverty level. So this policy change means that more people will now have premiums. However, prior to the pandemic, in the old premium scheme, premiums were much, much higher, and in some cases were hundreds of dollars. And so I think for many MAP members, it was a struggle to pay the premium. And there are always exceptions, but in general, we think that MAP members will have much, much lower premiums. It'll be much more affordable. And again, as you are working with people who are seeking different types of health insurance, MAP may be a much more appealing option than it was. Okay, so to walk quickly through an example, this is an example where someone's gross monthly income is at 206% of the federal poverty level. So they are above that 100% FPL premium limit. For simplicity, they don't have deductions, so their gross income is the same as their adjusted income in this scenario. And so you can see that what we do is we figure out how much more is their income than 100% of the federal poverty level. In this example, the difference is $1,288 a month. We take that excess and we multiply it by 3%, which gets us to $38.64. We add that $38 to the $25 minimum premium, which results in $63.64. We round down to the nearest dollar, and we end up with a $63 monthly premium. Wanted to touch briefly on two other MAP premium policies. One is that MAP members can apply for a temporary waiver of premiums if they have, an out of the ordinary situation that's causing them a financial hardship. And I wanted to mention that we also have a restrictive re-enrollment period for MAP. So if someone does not pay their premiums, they will go into that 3-month RRP. Unlike our previous policy, the pre-pandemic policy on RRPs, this one is curable. So before, if someone didn't pay their premium, they were really locked out of the program for a much longer period of time. Now, if someone doesn't pay a premium, they have the option of waiting out the 3 months and then re-enrolling in MAP, or paying their back premiums and re-enrolling right away, or if they go below 100% of the federal poverty level and no longer have a premium, or if they get one of these temporary waivers, they can come back in. So that was the brief version of what is MAP. I will now turn our attention to what is happening with MAP in 2024. So as I've said a couple of times, we are targeting January 1st as the date when we will start reintroducing both MAP premiums and the MAP work requirement, both of which have been on hold during the pandemic. And so if a member has, excuse me, let me say that differently. If a member does not have continuous coverage as of January 1st, they will need to pay premiums for January if they have a premium and meet the work requirement no later than January 31st of 2024. So when we're talking about members without continuous coverage, we're talking about people who applied on or after April 1st, 2023, or people who had continuous coverage during the pandemic, but have already done their post-PHE renewal. If someone still has continuous coverage as of January 1st, meaning they have not yet done that renewal, it's not been scheduled yet, they will need to meet the MAP work requirement as of their renewal, and they will need to start paying a premium after they've renewed in that next month. And so, for example, if someone's post-COVID renewal is not until March, then these policies are not going to come back into effect for them until end of March. So just to recap on the key policy dates, January 1st is when we are going to have these two requirements resuming for new applicants and existing members if they have done their renewal. And January 10th is the first premium payment due date for people who have a premium in January. And then February 1st is really the first date that anyone might lose eligibility for not paying a premium or not meeting the work requirement. So that brings us to our first polling question. And I think my friends at CWI might pop their version up onto the screen, but the question is, true or false, MAP members must work at least 20 hours per week to meet the work requirement. Julia or Elizabeth, are we polling here?
We are polling. We've got about
Okay.
half the votes in, so we could give it about, probably another 20 to 30 seconds, I would say.
Okay, great. You tell me when you're ready. Thanks.
Fantastic. All right, I think we can go ahead and share that poll. There we go. It should be up there.
Okay, great.
And we are at 33 or 30% true and 70% false.
Okay, good. Well, it was a little bit of a trick question on purpose. The answer is false. So, in order to meet the work requirement, MAP members need to have at least one work activity per month. But and that's it. They don't have. It doesn't have to be 20 hours a week. It doesn't have to be anything like that. It has to be one activity per month at minimum. And again, it can be employment, self-employment, in-kind income, or enrollment in the health and employment counseling program. I believe that that brings us to continuous coverage for kids. So I'm going to turn it over to Nicole.
Thank you. So, good morning. I'm excited to share with you all that Wisconsin is implementing 12 months of continuous coverage for children in Badger Care Plus and most other Medicaid programs as of January 1st of 2024. So, kids under age 19 will stay covered through their certification period, even if their family situation changes. And this is because Section 5112 of the Consolidated Appropriations Act, or CAA, made it mandatory for states to provide 12 months of continuous coverage for children in Medicaid and CHIP, with some exceptions, effective January 1st of 2024. So prior to that, it was a state option to provide continuous coverage for children, and here in Wisconsin, we had not adopted that option. So this provision is going to apply to most, but not all, subprograms of Medicaid. And it goes without saying that there are many benefits to providing continuous coverage to children, but some of these benefits include reducing churn and reducing financial barriers to care and improved health outcomes. Next slide. So this slide shows all of the children's groups that will qualify for continuous coverage. They include Badger Care Plus, former foster care youth, the Children's Long-Term Support Waiver, CLTS, family planning only services, foster care Medicaid, institutional Medicaid, the MAP program that Autumn just discussed, special status Medicaid, SSI Medicaid, SSI related Medicaid, and Wisconsin Well Woman Medicaid. The continuous coverage policy will not apply to children who are enrolled as continuously eligible newborns. Those enrolled through presumptive eligibility, people enrolled in Katie Beckett Medicaid or the Medicare Savings Program, those in a deductible, and also children who don't verify their citizenship, identity, or immigration status after their reasonable opportunity period. So once we have continuous coverage in place, qualifying children will remain eligible until the end of their 12-month certification period. Um, or when they turn 19, they're no longer a resident of Wisconsin, they voluntarily disenroll, or they pass away, so whichever comes first. And the 12-month continuous coverage periods will be established for eligible children at application when the child becomes eligible under a qualifying group. So if they moved from one of the non-qualifying groups to a qualifying group, or they're added to a case, added to a household at renewal. And then for existing members as of January 1st, they will have continuous coverage until their renewal date. So, children enrolled in a qualifying program as of January 1st of 2024 will continue to have coverage until their renewal date. So, for example, children in a household that enrolled in May of 2023, they will keep their benefits at least through April of 2024, even if their household reports a change that would ordinarily make them not meet program rules. New members under age 19 who enroll in a qualifying program on or after January 1st of 2024 will keep their benefits for a full 12 months. And next, I want to talk specifically about the SSI Medicaid population. So continuous coverage periods will be based on the month the child's SSI Medicaid began, and to ensure that they get at least 12 months of coverage. So when a child loses their SSI payments or eligibility, they will be informed that they'll keep their Medicaid until the end of the 12-month continuous coverage period. So they will keep their Medicaid even after they're no longer eligible for SSI. And then they will also receive letters about 45 days before the end of that continuous coverage period to tell them that their Medicaid is ending and the next steps. And finally, next slide. Children in foster care, subsidized guardianship, or adoption assistance Medicaid will keep continuous coverage until the end of their 12-month period or 3 months after they lose their placement, whichever comes later. There's currently a 3-month grace period to allow them time to transition to other coverage. All right, and for the next polling question, true or false? Any child enrolled in Medicaid on January 1st, 2024 will have 12 months of continuous coverage from January through December of 2024.
All right, it looks like we are starting to taper off here. If we want to go ahead and share that poll. And we are at 78% remarked true and 22% were at false.
All right. So the answer is false. So a child who's enrolled in Medicaid on January 1st of 2024 will have continuous coverage, but their 12-month period is based on their last application or renewal date. So in one of the slides I had noted, if someone was enrolled as of May of 2023, their 12-month continuous coverage period would end in April of 2024. All right.
Okay, so I think that brings us to the Q&A section. I'm going to take a look at some of the questions that have come in the live Q&A section. The first one that I see is from Tina. It says, more of a comment than a question for enrollment assisters, especially new people. If your income is $1,288 a month, you may have more affordable options on healthcare.gov with the silver plan than with MAP's $63 premium. So I fully acknowledge that there may be circumstances in which MAP premiums may be less affordable than what is available at the marketplace, but I do want to go back to that example and say that we were talking about someone with much higher income than 1288. 1288 was the difference between 100% of the federal poverty level and what the person's income was. And if I'm trying to look quickly to see if I can go back all the way through my slides without making everybody ill. To get to that, I think I'm going to just bite the bullet and do it. So I'm going to click quickly back to try to get to that example. Sorry, everybody. Okay, so this person had monthly income of $2,500. And we got to the 1288 by subtracting out what 100% of the FPL was. So again, it may be that I am totally on board with the idea that MAP may be less affordable than what's at the marketplace, but it is on a sliding scale. Um, and a $63 premium would really be only for someone who had in this example, $2,500 of income. So hope that's helpful. The next question about MAP is from Mark. I've been doing MAP re-enrollments and the IM has been asking for the work in-kind letters, so verification that someone is doing in-kind work. So what you were saying is they should not be asking for this. Is there some way to rectify this? So what I would say about this is that we have not been requiring people to meet the work activity during the pandemic. However, it is to everybody's advantage if they are still meeting the work requirement to provide that verification so that when they have their renewal, that work activity is on file. So I wouldn't, and I would say that our of our MAP population, almost all of our current members are still meeting the work requirement. We have a group of about um, 4,000 people statewide that where it appears as though they may not be meeting the work requirement, and we are planning to do some targeted outreach to them well in advance of their renewals so that they have an opportunity to start meeting the work requirement. Um, but we have not given direction to income maintenance agencies to stop collecting information about meeting the work requirement. We think that having that on file is to everybody's benefit. There's a question from Amber about, can you clarify what does MAP disabled mean? Yep, I blew through that pretty quickly. So normally when someone is enrolling on because they have a disability, uh, they need to have a disability determination, typically done by our Disability Determination Bureau or Social Security Administration. And that is a long and rigorous process, as many of you know, to get that formal disability determination. MAP disabled is a process that is specific to the state of Wisconsin, in which DDB goes through and they look to see, they do a very similar assessment to what they would do for a regular disability determination. The key difference is that uh, in MAP disability, under that MAP disability category, there is not a limit on someone's so-called substantial gainful activity, or SGA, that would normally come into play for a disability determination. So normally there's a limit on how much money you can earn and still be considered disabled. With MAP, that part of the disability test is not in play. So that is what constitutes being, so, sort of in quotes, MAP disabled. Okay. Okay, and then I have a clarifying question from Wanda on the question about MAP. But the first question we talked about MAP, person eligible for any type of Medicaid would not receive an APTC on the marketplace, right? And I'm probably not the best person in this room to answer this question, but that is my general understanding. You would not want someone enrolled in both Medicaid and APTCs. I think where Tina was going was, if a person was trying to make a choice between enrolling in MAP versus enrolling in the marketplace, and trying to do a cost comparison, just thinking about, in what circumstances would the APTC be a better deal versus where would or the marketplace coverage be a better deal versus where would MAP be a better deal. Okay. Looking for more MAP questions, and then I'm going to turn it over to Nicole for some continuous coverage questions. Michael has a question about, is the 12-month look back at independent accounts deposits and associated penalties affected by the MAP suspension of premiums? I'm going to turn to Nicole for some help on this, but my understanding is that with independence accounts, we are setting a clean slate because as we start doing unwinding renewals, typically that independence account assessment happens at renewal. So Nicole, can you verify?
Yep.
Saying that?
Nope, that's correct.
Okay.
We're
Thank you.
starting a clean slate for their next renewal.
Right. Yep. And then James also has some questions about MAP independence accounts. When it comes to the 50% savings calculation? Does it look at a full fiscal year of the earned income being saved, or does it include savings from SSDI? Is it counted 1/1/2023 to say 12/31/2023, or is it calculated each yearly renewal? So um, I'm just going to say one more time for those of you who don't work daily in independence accounts. So this is again that exempt asset type that where MAP members are allowed to contribute up to 50% of their gross annual earnings and have that asset be exempt, right? And if they exceed that amount, then we assess a penalty that gets added onto the premium to say um, you've contributed too much, right? You can't have this many exempt assets. And so the question about penalties um, is a good one. And the way that it works is that at renewal, we do a look back and say, okay, what were your gross income? What was your gross earning during this 12-month period when you had MAP? It's not based on the calendar year, it's based on your renewal cycle. And let's say, just for simplicity, that you earned, I'm just making up a number here, let's say you earned $20,000 in the year. The limit on how much you can have put in your independence accounts is $10,000. And so it is intended to be tied to earnings, but we don't really know where the money came from. So if it came from SSDI, then fine, as long as it doesn't exceed the amount that you earned, exceed the 50% of the amount that you earned. Okay. I am going back. I'm attempting to go back to questions, except I can't. Nicole, do you want to pick out a continuous coverage question while I try to get myself organized?
So Julia has asked, does an 18-year-old who turns 19 during their 12-month continuous eligibility period stay enrolled until the end of the 12-month period? And the answer to that is no. The continuous coverage protection is only in place under age 19. And so the children remain eligible until the earlier of the end of the 12-month certification period. They turn 19, they're no longer a resident of Wisconsin, they de-request or pass away. So if they've turned 19 and ordinarily lose coverage and need to apply on their own, that would occur even in the middle of the certification period.
Nicole, since we're talking about continuous coverage, do you want to take this question about if a child is enrolled through EMA, would they have 12 months continuous coverage? I'm assuming that means emergency medical assistance, but Laura or others, please correct me if that is a bad assumption.
If it is emergency medical assistance, then the answer to that is no.
Okay, thanks. And then there's a question from Claudia going back to, I believe going back to MAP, that says people can apply for state insurance from FPL 0 to 149% and pay the premiums if they are over the 100% FPL. I'm going to go back just one slide here and say that for MAP in particular, so we're talking again about people who have a disability and who are working, for MAP, anyone can apply, but people who will become eligible are people who have income at or below 250% of the federal poverty level. And if their gross income is above 100% of the federal poverty level, they will have a premium. And again, that premium is on a the premium is on a sliding scale. Sorry, someone just said they're not, you guys can't see my slides, so sorry about that. So the again, the income limit is 250%. The premium limit is 100% of the FPL. So if they're above 100% of the FPL, um, they'll have a premium, but it's on a sliding scale, and it can be as low as $25, and it can go up from there. Thank you. I do not see any other questions in the chat. So Elizabeth or others, if you guys have questions that you want to ask.
I think we'll give it some more time for some more questions to kind of roll in here.
Looks like there's a follow-up question on the MAP independence accounts, the 50% savings cap. So what I would say, and the question is, does that count SSDI plus earnings when looking at gross earnings? So the cap is set based on someone's earnings, right? So in my example, my probably not very well thought out example, if someone's earning $20,000 in the year, right? The cap for what they can contribute to that independence account is $10,000. And we don't consider SSDI when setting the cap. We only consider earnings when setting the cap. Where the actual money comes from that someone puts into the account, right? They may have other income. They may have, they may have other income that from their perspective, they're putting that into the independence account. But for us, the cap is what's important, and it's based on the amount of their earnings. Sue asked, at the beginning of your presentation, you said two things won't be considered for implementation or re-implementation. What were they? So we, I believe that what you're thinking of is that when I was talking about re-implementation of policies that are currently suspended, there are two that are specific to childless adults. One is childless adult premiums, and the other is requiring childless adults to answer a treatment needs question, which is a question about their need for substance use treatment as a condition of eligibility. Our federal partners have indicated that they don't plan to approve either of those policies starting January 1st, when we would normally we would have reinstated them. And so for that reason, we will not, we are not planning to reinstate those. So premiums for childless adults and the treatment needs question as a condition of eligibility. There's a question from Joshua about Medicaid coverage granted through MAP. Is it straight Medicaid, or does the member have to choose an HMO? I believe that the MAP population is a voluntary HMO population, so they can choose an HMO, but they are not required to. And then Tina asks, what do you think the next big challenges will be in the unwinding with the upcoming changes in 2024? Well, Nicole, I'd be interested in your thoughts on this, but I feel like helping members understand what is happening and when, particularly when they're going to start being subject to premiums or work requirements after potentially 3+ years of not having those things. I think that that's going to be a tough communication challenge, and it's difficult for us to explain it clearly what, and then let alone to help somebody understand when they have not been subject to those policies. So we are really trying to start now with our communication through letters and through working with our partners to try to get the word out, trying to be as clear as we possibly can be about the fact that these policies are starting back up, and making sure that people don't have gaps because they don't pay a premium in January, or they don't or they don't meet the work requirement. Nicole, do you have any other thoughts on biggest challenges?
I agree. The work requirements and premiums, also just ensuring people renew their health care, even if they think they might not be eligible, or renew even if they might not, children are. Um, I can't really think of any other big challenges. Thanks. There's a question from Sue. Relieved there won't be premiums for childless adults. However, will copays be reinstated? I have to say I don't know. As I mentioned, we're still really waiting for kind of the final word from our federal partners on what's happening with the provisions in the waiver. They have not, to my knowledge, provided as much input around the copayments for childless adults as they have around premiums and treatment needs questions. Um, so it's kind of hard. It's hard to predict at this time. We really don't know what the status of that will be. There's a question from Ellie about, do you expect any spike in enrollments? Excuse me, do you expect any spike in renewals during open enrollment at all? Well, I'm not sure if I totally understand the question, and so Elizabeth and others, you may be able to help me answer this better. But when we looked at renewals and renewal dates, we tried to distribute them as evenly as possible over the course of the 12-month unwinding period. And so people's renewals are when they're scheduled, and so and we did not give consideration to open enrollment when we were doing that. Um, so I don't think that they're linked, but others who know more about this may be able to give a better answer than that.
Yeah, and I'll just chime in. In terms of renewals, yeah, I would agree. Maybe new applications for Medicaid. We definitely always see that, even though open enrollment, of course, is linked to Marketplace. Navigators and CACs always see folks who come in with the promotion of Marketplace, but then in fact, they're actually Medicaid or Badger Care eligible. So for that, there will likely be a increase in activity around Medicaid eligibility.
Thanks, Allison. Amber has a question about any news on whether or not Wisconsin will start a work requirement for those on Badger Care Plus. I assume we're talking about childless adults. Work requirement slash community, so-called community engagement, was part of the original waiver that Wisconsin obtained to provide coverage to childless adults. CMS did formally rescind permission to impose those requirements, and I don't remember when they did that because I can't remember anything clearly from the last 3 years. But at some point during the pandemic, they formally retracted, or they formally removed their approval of the community engagement requirement. So we are also not planning on implementing the work requirement. And then Julia notes that cost consideration for MAP versus Marketplace also includes total out-of-pocket costs. MAP is a full benefit Medicaid program, and so she's suggesting compare premiums and factor out-of-pocket costs in a Marketplace plan, and then notes that access to care is also a factor, access to a broader network of care with Medicaid versus a smaller network in a Marketplace plan. Yep. Thanks, Julia, for raising that. And then we have a question from Lana, general question, when an adult slash caretaker member of Badger Care would lose eligibility without an extension due to income changes apart from their next renewal, if they are recertified at renewal, how do income changes between renewals affect eligibility before that renewal date? Not seeing what happens or timelines after changes are reported in our handbook. So I guess what I would say to try to summarize the general timeline of what will happen is that, and Nicole, please jump in and help me when I start to flail here. What we expect to happen is that when someone still has continuous coverage and they report an income change, they will keep that coverage, right? So until they do that post PHE renewal, they are really locked into coverage unless they pass away, move out of state, or ask to disenroll. When they are doing the renewal, if they have had an income change that qualifies them for an extension, which is, for those of you who are not familiar with that term, sometimes referred to as transitional medical assistance. And it's a process by which, if a parent or caretaker has an increase in earnings that puts them above 100% of the federal poverty level, they would normally lose coverage. I mean, they're above the income limit. So um, if they have been in Medicaid and then they have that earnings increase that puts them over 100%, they get 12 months of sort of locked in coverage. It's another version of continuous coverage, right? Where irrespective of their income, they get those 12 months. So for most of our members who are renewing post PHE, we expect if they have had that kind of income increase that they are going to go into an extension at renewal. And so they'll get 12 more months of continuous coverage. If we had someone who was a parent or caretaker who, for whatever reason, didn't qualify for one of those extensions, or um, who who didn't qualify for one of those extensions, um, they will either at renewal be above the income limit and so then not eligible, or they may be below the income limit. And as they move through their 12 months of coverage, which in this case would not be continuous coverage, right? They're not under PHE continuous coverage, they're not in an extension. If they have a change in circumstances, let's say they have an increase in hours and they um, would, and they have an increase in hours and they go over the income limit, there is an opportunity at that point to go into an extension. Um, if the income change were from something other than earnings and they just plain old went over the income limit and they don't have, and it's not prompted by an earnings increase, that's when they could lose eligibility. So if that does not address the question, please let me know. I will try that again. Um, it looks like there is a question about baby born in June of 2023. Nicole, do you want to take that? I'm not sure if that is a continuous coverage for kids question. I think it might be. I think let's call it one and then you can answer it. How about that?
Okay. If a baby is born in June of 2023, will he need to renew in January of 2024? And the answer to that is no. No, typically, children have a 12-month certification period, and some babies, when they're born, are a continuously eligible newborn, and they get 13 months of coverage. But there would not be a situation where someone would need to renew after only 7 months here.
Thanks, Nicole. I'm gonna move back to the marketplace versus MAP line of thinking. Sorry to ping pong between topics here. Jacob says deciding between marketplace and MAP would only apply to SSDI recipients who haven't qualified for Medicare yet, right? Doesn't Medicare make you ineligible for marketplace? So that is my understanding. Yes. And so when we're talking about people who are making those choices, it would be individuals who are not, who don't have a restriction around Medicare receipt. Okay, and then Tina asks, how can enrollment assisters help prepare consumers now for these upcoming changes? I think we are preoccupied with helping consumers through current changes and might not be thinking enough about 2024. So I think we're all sort of in that boat, right? We're still trying to get through the phase one of unwinding, and which will be ongoing. The good news is that there is still some time. We we are going to continue to update the partner toolkit that I shared early in the presentation to provide more materials and more information around premiums for MAP, premiums for kids, the MAP work requirement. So I would say continue to monitor the partner toolkit. We will also continue to share information through our Unwinding task force, through the stakeholder calls, through our partnership with Covering Wisconsin. Um, so I think, I think awareness is the first step, right? Knowing now that things are coming, and that as we get closer and closer to those to January 1st, that we're going to need to start turning our attention to those other policies. I think um, is definitely important, and we do have resources to support that effort as well. I see we have a couple of questions about food share work requirements, which I think we're not going to be able to answer today. So I'm going to pass on those. And otherwise, I don't see any other questions. So Elizabeth, I don't know if you have any other topics you'd like us to try to address.
No, I think that was a really great overview. So thank you for that. I think we can actually just go ahead and kick it over to Allison.
Okay. Well, thank you so much. And we get a bonus today. I think we wrapped up this session just earlier. And thank you so much, Autumn and Nicole, for that really important content. And I agree with the question towards the end there. It's important for us to start wrapping our heads around this, preparing mentally for changes to come, because only constant in this world especially is change. And we know that these policy changes, while exciting, are coming, and to start kind of being prepared for that while also continuing to do Unwinding, which will continue obviously through late next spring. Well, thank you everybody for your attention and participation today. Excellent questions. I'm glad we were able to get through most of those. And as Adam also mentioned earlier in the session, the first session today, there will be that Q&A session after the conference, where the link is already on our webpage, the conference webpage, and you can join that. That'll be this Friday. If you have additional questions that either we didn't get to or have come into your brain now or later, that's a great time to join. Maciel will be there, as will Adam from Covering Wisconsin. All right, thank you everybody, and we will see you again tomorrow morning for our final day of the conference. Thank you.